Thanks again for having me here today. I am really happy to talk about this topic. This is something that I started thinking about when actually I was on my postdoctoral fellowship at Vanderbilt. So I do want to start out with a brief acknowledgement that this presentation was created in collaboration with other individuals at Vanderbilt and in collaboration with the creation of these two toolkits, which I highly recommend if you have either a boy or a girl who is either going through puberty or even about to go through puberty. These are really helpful online and free resources. So some of the topics that I'll be talking about today are included in this booklet. Other topics are available on that website as well. And there's also additional resources. So example of visuals and other samples of suggestions of things that I would like that I'm going to be talking about. And in particular, I just want to mention Cassandra Newsom, Amy Whiteloff, and Stormy White, who were critical in helping develop some of the content and some of the slide content as well. So in terms of the focus for today, when you're giving a talk about puberty, it can go a lot of different directions. So we could potentially be talking about hygiene or body changes, or we could talk about relationships and sexuality. So for today's presentation, I'm actually going to be a little bit more focused on children who are just about to go through puberty, on preparedness for puberty, and some strategies that might be helpful if you're kind of already in puberty, but you need some guidance on things that maybe are earlier stage of puberty, like helping with hygiene and things like that. I will briefly talk about relationships, but only in terms of how you can try to help set up your child to be successful for longer term relationships and fostering appropriate relationships, rather than talking about specifically handling relationships right now if things like dating are coming up. So again, individuals with developmental disabilities and or autism spectrum disorder, again, before or early puberty times that struggle with a transition. And I also just want to note too that some of these topics can be really, really difficult to discuss. I've been giving this presentation now periodically over the last about 9 years. So I've gotten very comfortable with talking about some of these topics that otherwise can be really hard to discuss. So if you do have something that's maybe you feel like is a little uncomfortable, you can definitely put it into the chat. I'm comfortable taking, any question, even if you feel like it might be a little bit of an uncomfortable question for me. And so today we are going to start out just by talking about what happens before puberty. So if you have a child who hasn't gone through puberty yet, but is about to go through puberty, what are some things that you should be thinking about now? I'm going to talk a little bit about leisure life skills, so encouraging appropriate play and how that is important to carrying quality of life throughout the teenage and adulthood. I'm going to spend some time talking about hygiene issues, emotional changes that occur during puberty. Then we're going to talk about body changes that happen in girls and boys and how to plan for those in children with autism, how to help understanding public and private behavior, and then at the end, talking briefly about how to foster and set up success for appropriate relations in the future. So the timing of puberty. Of course, puberty, as you know, is a very normal part of the transition from childhood to adulthood. Everybody will go through it. Some people will go through it at slightly different times, unless there's an underlying condition that needs to be treated. The timing of puberty generally is the same for children with autism and other developmental disabilities. In some cases, with some developmental disabilities, we may also identify that there is precocious puberty. So a child who is going through puberty a little bit earlier than you would expect. The most important thing is to look out for some of those early body signs that we'll talk about later to identify when you think a child might start to go through puberty, so you know that you definitely need to prepare. Again, sometimes if a child has a more significant developmental delay, sometimes it seems like puberty just sort of comes out of nowhere, because in children who maybe have a fully developed body, but their development is more at the childlike or toddler-like level, sometimes it's like we weren't expecting this to happen. But it's important to think about regardless. We don't expect that any kind of developmental or cognitive delays would influence the rate at which an individual develops physically. Ideally, thinking about starting to discuss it even before you think you should think about it. So late elementary, early middle school for girls, often starting a little bit earlier than boys. And thinking about talking about it. So how do you even start the conversation? The first thing I would definitely think about doing is what terminology are we going to use? What language are we going to use, especially when we're talking about different body parts? One of the reasons to consider this is the co-occurrence of a language disorder in some of our individuals who are impacted by autism spectrum. So what we know is that sometimes once we learn a word for something, it could be hard to change that word. So thinking about what would be an appropriate term that your adult with autism could use, and teaching them that term when they're a child. Typically, we think about trying to use the more formal or appropriate terms, and that's the terms that I will be typically using throughout this presentation. If your child or your student uses an alternative or augmentative communication device, like an AAC device, there are picture exchange communication system cards for private parts, as well as icons that you can use on an iPad device as you start to incorporate this language. Thinking about how you have taught your child new skills or activities in the past is a good place to start too. How does your child typically learn best? Are they a visual learner and trying to present things more visually might be more effective? Have story-based interventions been effective? Those are two ways to go about thinking about puberty. So thinking about how have you taught your child to learn new skills or about new things in the past, and try to implement those same types of strategies. And trying to get everybody on the same page too. So in particular, everybody in the household being on the same page about some of these strategies and how we're going to handle different behaviors, or how we're going to help support the individual when they start to go through these transitions, but also having teachers and therapists on board as well. Especially if we're thinking about language, we want to make sure the language we're using at school and at home and in therapy sessions is all the same and coordinated, and that whatever supports are potentially being implemented in the classroom are being implemented at home, and vice versa. So if the teachers have a new idea, maybe we try it at home. And also if the parents have a new way or a new idea about how they're going to handle some hygiene or menstruation type issues, that we're also trying to handle that in the same way at home, so that things are really consistent across the different environments in which your child or your student is interacting with others. Like I mentioned at the beginning, there are a lot of things to talk about when it comes to puberty, and this is not an exhaustive list. And again, I'm not even going to cover all of these in my presentation, but I just want to put a little bit of an idea in your head that focusing on a variety of topics, and these can kind of age up with your child too. So initially we might be thinking a lot about hygiene and making sure that children are independent with hygiene, talking about what body changes they might be going through, making sure that our children are safe, especially as they become interested in things like dating and relationships, and also realizing that sexuality is an important thing that we need to address. Understanding gender and pronouns and what that might mean for your child or your student is also important, and not something that just because a child has a disability doesn't mean that they will not have sexuality, or that they won't have differences in how they in what pronouns that they prefer to use, or might identify as non-binary or heterosexual or homosexual or cisgender. We expect that our individuals with autism will also be experiencing those types of finding out about themselves and how they identify, and making sure that we're not just dismissing that piece. So the first thing I want to talk about is leisure life skills. And one reason that I think this is really important and important to address around the puberty time period is that children with autism and developmental disabilities tend to have a more restricted range of activities compared to typical children or typically developing children. Now, individuals with intellectual disability tend to report more having a less interest in a variety of activities, where our children with autism who do not have a co-occurring intellectual disability, they might report a typical range of things that they enjoy, but might in actuality engage in those variety of activities less. So even though they report that they're interested in 10 different things, we might see that they actually are really only engaging in a couple of things. And also we find that this restricted range of interest tends to become more restricted over time. They tend to be more passive, like listening to music or reading books or watching videos, and also more solitary. So in order to encourage good social development, encourage those social skills, we do really need to start early and build off our current interests to have more active skills over time, so that children are staying active into their teenage years and into adulthood, but also just have more variety of interest. So I'm just going to give a quick schematic about how to start thinking about life skills, especially if you have a child who maybe is pretty restricted in what they enjoy doing right now for fun. So here's sort of where I start. So maybe your child has one or two things that they seem to be interested in. And what I start to think of is, what are the components of that activity? So maybe it's built up of 3 or 4 different things that all go into that activity. So for example, if you have a child who enjoys passing a ball back and forth with a partner, what do we know about that activity off the bat? Well, we know that it involves balls. we know that it involves a single partner, and we know that it's low impact. So I started thinking about what are some other things that might build off this interest. So I try to think of activities that involve all three or many three of these things. So I can think about maybe this individual would like bowling. That's relatively low impact. It involves balls, and you can play it with one other person. Maybe this individual, for example, doesn't prefer to be in groups, but with a single partner does well. Mini golf could be something that could be fun. Ping pong, a little bit higher impact, but could be fun. Shuffleboard, tetherball, all things that might have a back and forth exchange, but will expand interest a little bit. You can also think about things that only involve, say, two of these components as opposed to all three. So if the child particularly likes playing with balls, but with one partner, but higher impact activities might be things like tennis or racquetball. And thinking about things that are low impact but involve one partner. They might enjoy walking and talking about preferred activities, kayaking or canoeing, rock climbing with the top rope, or dancing. So again, just trying to think about ways we can make sure that interests stay expanded across the teenage years and hopefully into adulthood as well. Okay, so let's really dig into some of the meat part of puberty. So the first part is good hygiene habits. This is something that that's very apparent when it's not going well, because there might be body odor that comes out or other issues that occur either at school or at home when hygiene is not going well, or the child maybe is not independent yet with hygiene. So new hygiene habits can be really hard to build. If you think about the transition from early childhood into puberty, everything changes. All of a sudden you have new things that you need to use that you've never had to use before. Maybe before you could kind of get away with doing a bath maybe every other day, and all of a sudden it has to be a daily activity. And if you have some of our children with autism do not prefer to bathe or do not prefer having shampoo placed on their head. So trying to think about how can we help the children learn this, that there's a transition from what we used to do to what we do now. So a new routine means that we need to start using some strategies that can be helpful. So new visuals and structure. And when I think about building structure or visuals into a routine, I really want to make sure that I'm addressing three questions. So the purpose of a visual is telling me, what do I need to do? What tools do I need? And when do I know when I'm done? And that's, I think, the when do I know when I'm done, I think is a really important part that sometimes gets missed a little bit, because you say, well, this is what you're supposed to do, but thinking about the whole picture, the whole routine. And I'm going to talk specifically about something that I call a hygiene kit on the next slide to talk about how you can create a little bit of this structure. It's important also to think about your child's specific sensory sensitivities or things that bother them. So for example, fragrances might be a particular concern. So seeking out things that are a little bit more mild in aroma or are fragrance-free options, especially for things like deodorant or taste, trying out different toothpastes for taste. Those are all sorts of things to play around with to see if you might be able to find things that are a little bit less triggering or cause sensory sensitivities. Hair washing is another common sensory sensitivity that we hear about it a lot sometimes in young kids, and it can be a little bit of a struggle between parents and kids to get hair washing done. So a couple different strategies that you can think about using too are just finding a different way to help wash the hair. So there might be children who prefer to be under the shower head. There might be children who prefer to be in a bath and dip their head back. There might be individuals who might be okay with having a pitcher of water poured on their head. In the meantime, too, while you're working on building up to that, you can think about, well, what are some ways where we can help manage hair in the meantime? So dry shampoos. If you put dry shampoos on at night, usually that can be helpful to carry through to the morning. And for some kids, you might be able to get away with washing just a little bit less if you also build in some of the other strategies you can use, like dry shampoo into the routine. It's also important to consider any kind of motor difficulties. So many of our children with autism might have fine motor concerns, have a little bit more trouble with using their hands compared to other children. So thinking about using an electric toothbrush, which might vibrate and be a little bit bigger and easier to hold, or having a wrist strap so it stays on their arm as well. The same thing if your child might be thinking about shaving or using a razor, having a wrist strap for the razor. In terms of razor, if your child does want to shave, but the process is really hard for fine motor skills, they do make deodorants now as well that have a hair removal built in, if that would be something that would be a little bit easier for them to manage. So let me talk a little bit about hygiene kits. So a hygiene kit is sort of what I think about. So if I have my morning routine, what's everything that might go into my hygiene kit? Now, if your child is not into puberty yet, it might be a good idea to start building a hygiene kit now. So thinking about what would go into a morning kit. So I would definitely have my toothpaste, and I would have my toothbrush. And if I'm a younger child, that might be mostly what's in my hygiene kit in the morning, maybe a hairbrush, depending on how long my hair is. But as you get older, all of a sudden it expands. Like maybe you need face lotion, or maybe you need acne cream. And if you have a kit that the child knows every morning, I need to use every single thing that's in this box one at a time, then that helps explain what do I need to do and when do I know when I'm done, once I've used everything in this box. And if you have established this idea of a morning kit, then you can start expanding it. So you might also have a shower kit. Now, obviously, this is not necessarily a shower kit that we would have for all of our teenagers. Might be a little bit too much or too fancy, but you can think about what would you put in that shower kit and helping that child understand that I need to use everything in the kit in order to know that I'm done. So again, building in that additional structure. You can also break this down into a specific schedule. So maybe your child to have their kit, but they don't know where to start. And that can happen too, especially if you build the kit up too fast. So if you say, okay, well, my child needs to do 10 things in the morning, I'm going to put them in here, I'm going to give them the kit, and they're going to go. They might not realize, like, well, what am I supposed to do first? So you can number them to let them know, okay, the first thing you want to do is put on your acne cream or put on the lotion. And then number 2, labeled with the number 2, could be putting doing the toothbrushing. You can even break it down even smaller than that if you need to. So if you need to have pictures about exactly how long you need to brush your teeth, wait 2 minutes, setting a timer, all of those little bits of structure can be helpful to add in. So even if you need to add in an order. We also hear sometimes that either children are spending too long in the shower or too short amount of time in the shower. A couple different ways that you can think about that. So I've had some families that have been successful with having a CD that has different tracks on it, and each track represents a part of their body they're supposed to be cleaning at that time. And when they get to the end of that track, they need to move on. So it keeps them on cue with how long they should be spending in the shower. And then also thinking about, for those kids who might miss a part of their body, what can we build into the showers? For some kids, it could be a checklist of everything that they need to do. Other times we've had families use pictures or drawings of a child, and each kind of body part, once it's clean, can go into a bucket. That's the done bucket. So I know I've washed my left arm, done bucket. I've washed under my arm, done bucket. And so that way they have a visual to remind them of all the different things that they need to be washing while they're in the shower. So adding in just those extra little supports throughout the day, because really, when I think about this too, the goal really is independence. So we want our children to be able to shower without us having to check, but giving them the support that they need so they can be successful in that. And then over time, once they get very successful with the kit, maybe they don't need all of that anymore, but it's there for them if they do need it to help keep them independent. Thinking a little bit too about mood changes, of course, we do anticipate and expect mood changes when children are going through puberty. And some amount of changes is typical, but it's really important that you're also tracking your child's mood and behavior for any red flags. Anything that is a major deviation from their baseline, it is something that's important to consider, especially if you think about our children who maybe are minimally verbal or nonverbal or don't have the words to express how they're feeling, or if they're upset or potentially even in pain. We need to take those cues very seriously. I always think about whenever behavior happens, regardless of age, but even remarkably so in puberty, behavior is communication. So if your child is seeming irritable or upset or engaging in behaviors that are not typical, my first thought is, what are they trying to tell me? And in puberty, I might be thinking, okay, are they trying to tell me that they're not feeling well, that they're having trouble expressing emotions, that they're frustrated, or is there something else going on that we need to address? Building emotion words and coping strategies as well. This can be done both in speech therapy as well as social skills curriculums. If your child is engaging in a curriculum, maybe at school or in an after school or summer camp style program, social skills curriculums often talk about not only identifying emotions, but labeling emotions, and then also trying to understand how to cope with negative emotions. If your child is really, really struggling with negative emotions, we also recommend what we call cognitive behavioral therapy. You might hear it also called CBT, or abbreviated to CBT. Children who are feeling very anxious or upset, and often those types of anxiety and depression and mood issues often emerge around puberty and sometimes do persist into adulthood, and cognitive behavioral therapy is a first-line treatment for that. I also briefly want to talk before we get into some of the different body changes that we might be addressing in girls and in boys, is that you need, for all the parents, you need to know what the school is talking about. So depending on your school district, you need to know, is your child exposed to part of sex education curriculum at school? If not, it could be that the school is expecting that you're teaching it, or it could be that the parents, sometimes we just assume that they're getting all this information at school. But children can learn about sex and puberty from a variety of sources. They can learn about from their parents, and they can learn about it from their teachers, but they can also learn about it from their peers. And sometimes peers don't always give the most accurate information about puberty and things that might be going on with their body or their feelings or their emotions. So if it's not happening in school, then you need to know where it is happening, because it could be happening from unreliable sources, or it likely needs to come from you, or you need to work with your school system about providing some developmentally appropriate sex education to your child. So again, why do we need to incorporate this? So may learn less from peers or make it misinterpret information. And we need to make sure that we have a venue to adequately address any misinformation or misconceptions that might be going on. And then also make sure that we're building in lots of practice and repetition, both for hygiene issues and also other issues related to puberty. So I'm actually going to start by talking a little bit specifically about girls and puberty and some of the body changes and things and tips and tricks on how to address those body changes happening. Then I'm going to talk a little bit about boys. So the first thing related to girls is talking about breast development and initiating using bras. So this can be difficult for some girls to make this transition from having a long time of not needing to or not wanting to wear a bra into actually getting to the point where they might need to be wearing a bra to go to school. The first, one of the earliest signs of puberty is actually the development of breast buds, which is just a small little, right behind your daughter's nipples. She'll start to develop just a little bit of a bud there. And that's a very early sign of puberty, and a sign that you should definitely start prepping now for her potentially wearing bras and also just other things related to puberty. Again, the word breast is not something likely that she's had in her vocabulary until she actually develops breasts herself. So consider the terminology that you were using. Again, we typically recommend using those formal terms so that there's not a point in time in her future as a later teenager or as an adult where she has to stop calling breast, she has to start calling it breast and stop calling her chest a word that a different word that she had been maybe using prior. You can start preparing for bra wearing long before a bra is actually needed. So there are many different ways to go about this. So of course, training bras. There are also lots of camisoles that have the thin straps that have a built-in shelf bra to just help children get used to that feeling of that little bit of extra pressure that might be along her rib cage when she starts to wear a bra. So it's just getting a slow adjustment. And it doesn't necessarily mean at this early point, if you start early, that she necessarily has to wear a bra all day. We could just practice it on weekends. Maybe we practice wearing it for an hour. Maybe we practice wearing a swimsuit top underneath of something. After we get out of the pool, we put a cover up on and practice wearing the top of our swimsuit instead of just taking it off so she gets used to that feeling. Also considering her preferences and her comfort. Does she want a bra that's pretty? And that might motivate her actually to wear a bra if she has one that she gets to pick out and that she really, really likes and she thinks it looks nice on her. And then also just consider, what is she able to do independently? The bras that snap in the back can be really hard to learn how to use. And again, thinking about fine motor, that's something that's going to be difficult for her. Maybe we can think about other types of bras that she could wear. So they make lots of bras now that are pull over. They have bras with padding and without padding. There are bras that fasten in the front that might be a little bit easier for her to use. So again, really thinking about independence. We don't want to have her have help every time when she puts on a bra. We might need to encourage her and help her initially, but ultimately we want her to be in charge of wearing and using her bra. Menstruation is also an important piece and something that I think can be intimidating for families to think about how they're going to manage, because menstruation is something that can be alarming and sometimes surprising to typically developing children, regardless of their overall chronological or developmental level. So Ideally, we're teaching her that her period is going to come before her first period comes. The average age for a period for girls is about age 12, but it can come much younger. Again, the breast buds developing, maybe seeing a little bit of pubic hair is going to be your first sign that this is imminent and it's going to be on its way, and it's a good time to start practicing. It's important to let her know what's going to happen too, because you want to make sure, one, that she knows she's not hurt and then it's very normal. It's also important to note that that sometimes blood initially does not look red when children get their first period. Sometimes it looks a little bit brown. And so even if you've been preparing her for puberty, she might think that she actually maybe just didn't wipe very well if she's independent with toiling. So making sure that you let her know that it could look red, it could look like blood, or it could look a little bit on the brown side when she actually does get her first period, so that she has an idea about what is potentially happening. Toileting independence, I think, is kind of inextricably linked with menstruation independence. If a child is toileting independently, my goal is always that we teach to manage menstruation independently as well. And also making sure that we're thinking about all the things that go along with menstruation. So is she having any pain? Do you see her holding her stomach? Does she seem more irritable? And talking to her doctor about ways that you can kind of help her through those times if she is struggling with cramps or other moodiness associated with her period. Some other things to consider before the period starts is if your child has a visual impairment. So often when we use things like pads for managing menstruation, we teach children to identify based on what they see, whether or not it might be time to change her pad. But if she has trouble seeing, that might be a little bit harder for her. We might need to implement something like a timed strategy. So how often do you need to be changing? And then also motor impairment. So some of the tools that we use to manage periods require significant amount of motor skills. So pads that have wings that wrap around are a little bit harder. The packaging can be hard to open on some of the different items. Tampons also are much more difficult to use with fine motor skills than some of the other options. But at the same time, we also want to make sure that she has access to the range of options that other women have. There are lots of options out there for us to help manage our periods. Again, like with the hygiene kit, consider a menstruation kit that's tailored to her needs. So if she does want to use pads, or that is her preference to use pads, you could go ahead and unbox them and unwrap them for her and just place them as individuals in there. Again, making her as independent as possible. Same thing with tampons, unboxing them, unwrapping them, and having them ready for her so she doesn't have to worry about some of those extra steps. Recommend practicing earlier too. So even before you get to the point of needing to wear a pad, buy some panty liners and have her start wearing them. They're much smaller, they're much more comfortable and it'll teach her just what does that feel like if you have something else in your underwear. They also make a lot of period underwear now. I see the ads on social media, a fair amount of the different brands that they make. They are a little bit more expensive, but they are reusable. So if we can teach her that this is the underwear that you wear when you're on your period, if she's able to do laundry or help with laundry, she can help wash them later, or she knows that I wear these and then I put them maybe in a special place after I'm done with them for the day where they can be cleaned appropriately. Also helping her try to track her period timings if she can, or you can, and I would recommend when she first starts that you actually track it with her so you can see what might be helpful for her. If she already uses visual schedules, it might be easy to transition her to using kind of a calendar so she kind of knows when it comes. Of course, when girls start their period, it might be a little bit more irregular, so sometimes it can be hard to figure out until she's had a few cycles. And then also making sure that she understands that periods are something that are considered to be a private behavior, that she shouldn't necessarily be telling her peers at school that she's on her period. And we'll talk more about public and private behaviors in a bit too. But again, that period is one of those behaviors that's considered to be private, and making sure that she has a way to ask to go and have and change her pad or change her tampon if she needs to at school, especially if she's reticent to do so. Maybe she can go to the nurse's office, or perhaps in her IEP, if she does have an individualized education plan, that she is permitted to have timed breaks so that that she can change her period management as needed. So birth control, of course, this is something that teenagers use to help manage periods. So family values, of course, are an important part of the conversation, but reasons that birth control is used sometimes in children with puberty is to reduce the pain associated with having periods, reduce the amount of bleeding that happens during periods if she has very heavy periods that are hard to manage, improve irregularity. So if you can't predict when the cycle is going to come, going on a form of birth control can help identify and help parents and teachers know when those are going to happen, sometimes reducing frequency, and in some cases suppressing periods entirely. If she's able to, definitely involve her in that process so that it's something as well that hopefully if if she's on the pill, it's something that she can manage independently. But again, some questions to talk about. So what would be the reasons for or against placing her on birth control and having that conversation with her doctor? What methods are available? Can she use those methods? Are they safe? And then what's generally best for her overall quality of life? In going on birth control, often a female health exam is something that doctors require that teenage young women have prior to going on birth control. And this is something that is a health disparity among a wide range of individuals who have developmental disabilities as an inability to access a female health exam. There are specialty centers across the US for autistic adults. The one that I'm aware of in our area starts taking children around the age of 12. So around the age of a first period, they'll start taking children or young adults into their care and have OBGYNs who specialize in working with adults who might have developmental disabilities or autistic adults. I really, thinking about female health exams, but really any difficult exam, I like to think a lot about practice visits. So is it something that we can do and not do the whole exam, but could we just do part of it? So could it get to the part where we just practice putting on the gown and laying down on the table? We just practice putting on the gown, laying down on the table, and putting feet in stirrups. So just practice little parts of it until we're able to work up to the parts of the visit that might be the most challenging, as opposed to just trying to do it all in one go. Again, having clear communication with the doctor that you're working with, and then also providing distractions. So bringing in the iPad and making sure that she has something else to do to keep her mind off of what's going on in the visit, especially the parts of the visit that might be considered a little more aversive or a little bit more painful. Okay, I'm going to switch gears now and talk just a little bit about boys. So in terms of body changes, the one thing that you'll note, of course, is that you might see an increase in the frequency of erections that boys are having at this time. This is a very typical part of puberty. There's nothing necessarily that he did or didn't do to cause periodic erections throughout the day. If you're a parent, you'll probably also note that as younger boys, you'll also see that they do experience erections. They might be rubbing or touching themselves. And at times when these erections occur without any warning or without any clear trigger, that might be embarrassing, especially if they happen in public. So making sure that we're not calling excess attention to him or making him feel embarrassed for having an erection, letting him know if he is embarrassed that it's a very typical part of puberty. Similar to what I just talked about with menstruation, we need to have clear expectations too regarding public and private behavior. And like I mentioned earlier with the importance of talking about this, just avoiding the conversation might lead to confusion as to whether or not this is a public or private behavior, especially thinking about what his peers might be talking about. He may not know if talking about erections is public or private. So having that clear conversation that is a private behavior related to a private part. Again, considering tighter or brief style underwear to help manage the visibility of an erection in public, and also providing him strategy. What do I do if I get an erection in public? So, you could stay sitting down until it is gone. Making, if you're at school, you can carry your books in front of you so that nobody else can see what's happening. Nocturnal emissions also happen around this time. So it's an ejaculation that occurs during sleep. Again, just like the erections, this is a normal part of puberty. It's not under his control. And it's important to let him know what has happened. Some boys, especially some of our boys with intellectual disability or developmental delays, might think that they wet the bed as opposed to having a nocturnal emission. And sometimes that can be embarrassing for the child and they don't know what's happening. So making sure that we're teaching, we know this is going to happen. We know that this is a normal part of puberty, and also thinking about the structure. So what happened? So you had a nocturnal emission. That's something that's normal that happens to boys around your age. Why did it happen? It's normal. It's part of growing up. And what do I do when it happens? So this, again, is going to depend on your individual or your child that you're working with, their level of independence with doing things like stripping and changing sheets. If that's something that for a fine motor skills they're not able to make, they might be able to take sheets off, but they're not able to put sheets on yet. They can hang, having some way to communicate with you without having to call excess attention to what had happened, that he can tell you, I need to have my sheets changed. That could be a door hanger that he puts on his door to let you know, without having to actually come up and tell you, Mom, I had a nocturnal emission, that his sheets do need to be changed. Around this time, I've already kind of alluded to this throughout a few different parts, but thinking about public and private behaviors is important, especially during puberty, for a few reasons. One, to make sure that our kids are not getting into trouble, and also keeping them safe. So it's really, I think, twofold in understanding public and private behaviors. So thinking about behaviors that might be private would be touching private parts, masturbating, undressing in public, making sure that we know what parts of our body need to stay covered versus what parts might not. Swimsuits are a good way to teach that. And then also thinking about inappropriate or interactions with others. I'm going to talk about this in a little bit later when it comes to relationships, but I think one thing about public and private and interacting out in the real world is that sometimes things are really cute when kids are 4, but they're not cute when they're 12, and they're definitely not cute when they're 18. So things like sitting on teachers' laps. I always get concerned when that goes on too long. And I always think about, we don't necessarily hug our teachers. The mantra that I always kind of think about that comes from a colleague of mine is handshakes, not hugs. So when we meet somebody that we don't know, we shake hands. We don't necessarily hug. We don't sit on their laps. Those kinds of things can be inappropriate and might lead to long-term consequences. And thinking about how to teach public versus private behaviors, the first thing, and I think this sometimes can be difficult, is making house rules. And if we want to understand, if we want to help our children understand about when is it okay to say undress, we need to be really clear about when that is okay. And that means sometimes that the whole family needs to follow that rule. So there's no ambiguity. So if dad has a tendency to walk around with his shirt off, we might say, hey, while we're learning this, we might want to just have everybody be fully clothed at all times, except in your room by yourself. And also making sure we're engaging in direct teaching strategies. So what parts are personal parts? Again, swimsuit rules is a good way to start teaching that. Where can personal parts be touched or uncovered? And making sure, so in the bathroom by yourself, in the bedroom by yourself. The reason I emphasize by yourself in the bathroom is not sufficient because there are public bathrooms. So making sure it's in the bathroom by yourself, or in your bedroom by yourself is an important piece to make sure that we're teaching. If a behavior has already started, so behind the 8 ball a little bit with already teaching what's public, what's private, sometimes social stories or story-based interventions can be helpful in these cases. So we start to say, this is where, really spell out where certain behaviors are appropriate or where behaviors are not appropriate. In some cases, redirection when available can be helpful. So hands out of pants, again, being very matter of fact about what's going on. We're not calling too much attention to it. We don't want them to know that if they strip down or start touching themselves, that they're going to get a ton of attention, or that if they do that, they're going to get out of something. So be like stripping at school. Sometimes that can get you sent to somewhere you want to go. Some kids want to go to the principal's office if they know that they engage in that behavior. We'll get them there. So again, matter of fact, we're done with doing that, and we're moving on. Specifically thinking about masturbation, this is something that's very common between both males and females. You might actually see some behaviors that look like masturbation that occur prior to puberty. So you might see both girls and boys of younger ages touching or rubbing their private parts. Again, minimizing attention to the behavior and staying calm is important. Punishment can often backfire because punishment does call attention to what's going on. So I would be, again, very matter of fact. And then setting boundaries on the behavior. Again, for masturbation specifically, I would recommend in your room by yourself, not in the bathroom. You leave the bathroom completely out of the scenario. So that way there's no risk if they get confused with bathroom that we're not going to a situation where it's public, where it's a public bathroom or a bathroom at school, like bathroom at home alone. So the three kind of things I think about, the three M's of masturbation: minimize access, minimize attention, consider a medical exam. So minimizing access could be ways that you can kind of prevent a child from actually accessing their body parts. So like a leotard or a onesie type thing can help with ability to access private parts. Again, minimizing attention that we have talked about. And also important, if it's excessive, consider a medical exam. You might be thinking there might be other things going on. There could be, especially with our children who have trouble communicating pain or communicating emotions, we want to make sure that we're not missing something that could be medical that might lead them to be touching their private parts more often, like a urinary tract infection. Okay. So now I'm going to talk just a little bit briefly about relationships and safety. So, I think it's important to note that you should expect to see a desire to form friendships and also romantic relationships as kids get older. They might start seeing other children start dating. If they have older siblings, they might see them start dating and kind of want to know how that might apply to them or what they might be able to do as well as they get older. So important, and I'm focusing here on what kinds of relationships should you teach about, I think, very early on. So early in the puberty process, to try to help children understand what appropriate relationships are and foster good relationships and strong relationships. So one, we definitely need to teach about protection, so protection of our kids to keep them safe. Also, having good relationships definitely improves quality of life. We want to make sure that our children understand different kinds of relationships and also understand that appropriate behavior is different in different kinds of relationships. So here's just a quick example of how I can potentially set this up. So there are different, so we have families, we have friends, we might have acquaintances, we have coworkers, we have strangers, and in some cases we may even have a boyfriend or a girlfriend. This number of categories might be too many for your child if you're just starting off. So it could start with families and friends and strangers as a very simple way. Also having like teachers, I didn't put that one on here, but teachers is another category that you might want to consider if your child is attending school. So you need to be clear about the differences between categories. If you have pictures of the different children, different people in your child's life, you can have them do a sorting activity to help them identify, okay, is this a family or a friend, or is it an acquaintance or a coworker? And then also making sure that we talk about what appropriate interactions are. So it might be, what kind of greeting would you give a family versus what kind of a greeting would you give an acquaintance, or what kind of greeting could you give a teacher? And you might have different things that are okay in different categories. We want to make sure that we know certain things are not okay in certain categories. Also, conversation topics, as we talk about public versus private behavior, conversation topics. So you could potentially include doctors on here and clarify that some of the things that you've said are kind of no-no topics might be okay as long as you're discussing it with, say, a family or a doctor. Some children might start to ask about dating even in early puberty. So the first bullet point is really thinking about as a family, how you're going to address it. So what do you consider to be a date and to what extent is it allowed? Also, children might pick up that there are double standards. So if they have a sibling who maybe is an older sibling who's allowed to date, but for whatever reason they're not allowed to date, or you're unsure about dating for them or what that means, then just something to think about before it even comes up so that you can address how are we going to handle dating as a family or as a unit. If they are allowed to date, so what is allowed to happen on a date and what constitutes a date? So is a date a sort of a group outing? That can be a date, and they could have a parent or a supervision with them. And then also making sure that children understand kind of, how do you know if somebody actually is your boyfriend or your girlfriend, or are you just going out as a group outing, going out as friends? We definitely want to make sure that children understand about unsafe relationships and protecting our children from abuse. Of course, bruising, particularly on areas that are unexpected, like the ears, the genitals, or other unexplained injuries. This is more concerning for our children, especially our older children who are less independent. They tend to be more at risk for abuse as older adults because they rely on others for their daily care in a way that some of our children who are more independent do not. That's why I always think about, we want to encourage as much independence as possible. And monitoring for any changes in behavior, like withdrawal or wanting to stay home from things that they previously enjoyed. Building that, focusing on that public-private behavior, if we can get that skill kind of solid and down pat, that can really help protect our children, because we're building in this idea of private parts into concepts that might relate to possible abuse. It's also important to note that teaching your child about stranger danger is not enough. So most children who are abused by somebody that they know, but making sure that we understand what is appropriate behavior versus what is inappropriate behavior and who to tell, and also understanding that concept between good secrets and bad secrets. I also think in our day and age, we have to start thinking about younger and younger and younger about internet protection. So making sure that children are keeping themselves safe by not posting things on the internet that they should not be posting, and also making sure that they're not responding to things that might be inappropriate. So what sort of things would you think are okay to post on social media? And just making sure that there are specific things that if you are going to allow them to post things on social media, that they understand very specifically what is okay to be posting on social media versus what is not okay, and what is not okay to be seen on social media as well. And being specific and making sure that we're monitoring their access to those things, especially if they might be receiving messages from other people as well. Okay, so I think we probably have about 15 minutes for questions or so. So I will stop there and put me back on camera. And I'm happy to answer any questions.
Great. Thank you so much, Cora. We've definitely had quite a few questions come in between the Zoom and the Facebook Live. So thank you everyone for submitting questions, and please feel free to continue doing so. One thing I do want to ask right off the bat, because we did have a few people asking about the OBGYN specialist that you mentioned. I think some people just missed that name. So if you're able to, one, share that name again, and also share some information about what parents could be using as keywords in their Google searches for these sort of specialists.
Good question. Yeah, so I didn't share a specific name. I shared a center. It's actually in Pittsburgh. But if Autism Speaks actually has a site, and you can just look autism friendly OBGYN or autistic OBGYN, and that's a good place to start to find some of those centers. Or you can type in developmental disability and OBGYN, or women's health and autism.
Great, thank you. I know, I think it was really great that you separated out, girls going through puberty, boys going through puberty. I know specifically with the girls, you were mentioning the development of breast buds as a sort of a key indicator, perhaps for parents that their child might be beginning puberty. Can you talk about some other things that parents should look out for? I know you've mentioned them throughout, but just sort of summarize for boys and girls, some of those key indicators that puberty is approaching.
Yeah, so for girls, for girls to going to their annual, you talk to their pediatrician at their annual visit and make sure that they're doing a full physical exam, because they can let you know about what's called the Tanner stages. The Tanner stages are an indicator of sexual development. So things, so different things might be development of pubic hair, again, developing of the breast buds, different growth of the penis, all those sorts of things might be things that the doctor could be looking for, and they can give you a guess about where he is and maybe if you're expecting it within the next year or two.
Great. And then specifically talking about boys going through puberty and as they're experiencing these bodily changes and growth, is it common that they may mistake some of these feelings and changes as an increased need to use the restroom? And how would something like that be handled or addressed?
Sure. Yeah. So I don't know that I've necessarily heard that specifically, that people notice that they have an increased need to use the restroom. I mean, certainly I would definitely have this doctor check out if there is an increased need to use the restroom, because there could be a lot of different things going on. So if he's peeing a lot, that could be sort of underlying something endocrine going on. So actually the first thing I would do is just make sure there's nothing going on from his doctor's pediatrician that would be causing sort of, if he's having increased urination or anything like that, before saying necessarily that's entirely puberty. Again, they can also help you with the Tanner staging to see if that might be reasonable to see that if puberty is happening at that time. But I would start with this doctor just to make sure there's not anything underlying medical that might be causing him to use the bathroom more frequently.
And sticking with boys for a second. So as they're going through puberty, there's that buildup of testosterone that could lead to some more aggressive behaviors. And do you have advice for how parents could handle those behaviors or address those injurious behaviors?
Yeah, so I mean, so sometimes we see, more irritability, which might lead to more aggression. I wouldn't necessarily say it's just like testosterone alone that's sort of causing aggression, or autism is causing aggression at all. But if there's and it's going to be very specific to the child. So for, if a boy is getting a lot bigger and maybe he's always been a little bit irritable, if you see an increase in irritability, you might see maybe some more outbursts going on. Communication is a huge part of handling challenging behaviors and making sure that your child in some way has a way to communicate their wants and their needs and their feelings with you. For the more nonverbal or minimally verbal children, if you haven't looked into getting a device or a communication system for your child, and they are having any kind of aggressive outbursts, I would start there, because usually we can see that if we provide a way to communicate, we can see a decrease in behaviors. If you're also seeing increased irritability or things like that, it might be worth talking to your child's doctor or psychiatrist about what's going on. Certainly when children, as I mentioned before, when children are diagnosed with sort of mood disorders or anxiety disorders, often those symptoms tend to emerge in early teenage years. Early to mid-teenage years is when we see those psychiatric conditions come up. So I'd also maybe talk to his, if he has a psychiatrist that he's working with or a pediatrician that he's working with, to see if medication management might be something that would be helpful.
Great. And I've seen a lot just in the past couple minutes, a lot of questions come in about how to best communicate about puberty and the opposite sex with your children, in addition to speaking about, their own body changes.
So, I mean, I think the first question I have is, going back to that first slide, is, are they exposed to this curriculum at all in school? Because if they are exposed to the curriculum in school, they will have some ability to kind of learn about puberty in the opposite sex, and we won't just be teaching about themselves. If you are wanting to teach them about the opposite sex and you don't feel like it's getting done or done adequately at school, I think you can kind of start with sort of public and private behaviors, and you can start very basic with, girls and boys are different. We have different body parts, and making sure they understand, because a don't touch for me is not necessarily the same as don't touch for a boy. So focusing on public-private behaviors, the differences in body means, and what those differences mean. And I think you can also judge on your child's developmental level about the extent that you need to get into things like what is a period and what's menstruation. So if you want to teach boys about girls, I would say it's important to teach that girls have different private parts. Here are no touch parts for girls. And you can kind of teach the same thing for boys, but also, thinking about how much you necessarily need to get into menstruation specifically, depending on their developmental level. It might be very appropriate, but it may be more of just a general conversation about boys and girls being different.
Focusing a little bit on the relationship and safety bit that we just closed out on, are there any, there's some differences in how you look communicating around safety and relationship safety with nonverbal preteens or, kids going through puberty?
Yeah, so for nonverbal, I think I would think about what visuals that you could use. So if you understand the idea of so first of all, again, if they have a device, that's sort of where I would start building in, you can build in words for private parts into their device so that they know the terminology to have a way to tell you if anything happened the best they can, but also having and actually there's a good activity in one of those, those toolkits I showed at the very beginning, the Preparing for Puberty Healthy Bodies toolkit, is just a visual of a person and green lights and stop signs. And so at least trying to teach that in a very basic way, like having a task where this is a stop sign. So a lot of our children, they do understand the idea of stop or no. So can we try to teach them in a visual way where is sort of stop or no?
And you mentioned some of the, the hands out of pants as a way to sort of redirect or stop a behavior. Do you have any other redirecting tactics for boys and girls perhaps that you could recommend or perhaps elaborate a little bit on?
Sure. So, the biggest thing for me is if it's getting to the point where you feel like you're having to do it constantly, it's not manageable, because certainly somebody has to be there to do kind of stop or hands out of pants, is blocking access. So the extent that you can have something where it doesn't even come up, then you can completely ignore what's going on versus having it come up entirely. So I would try to find a way where you can actually just block the behavior from even starting if you're at that point where hands in pants is not manageable. At home, sometimes it's opposed to just saying hands out of pants, you can also just redirect to the place where it is appropriate. So if you are saying, okay, that's okay, but you have to be in your room by yourself, then redirecting actually to the room rather than saying like, you have to stop hands and pants. So that's not manageable at school, because at school you do have to stop the behavior or have blocked access to the behavior. But at home, if you wanted, if you wanted to potentially try to teach that connection between where is this behavior appropriate, you could redirect to a location rather than just saying stop hands and pants.
I know we didn't talk too much about the sex ed component of this, but just maybe quickly, if you have any tips on how to discuss really just the vast majority, like the access to what's available online and pornography and sort of the dangers of some of the internet availability of what's on the internet.
Yeah, I mean, I think the big thing there is just making sure that you're blocking access to everything that you can as much as possible. I mean, there are some things that are going to be potentially out of your control. If they have friends at school, they might be seeing things that they otherwise can't. But I think if you have to have your devices locked up as you possibly can, have all the parental guidance controls on. If you're already using the iPad or other thing as a reward, having only certain apps available, and also time limiting how long that they're on it, so that if they get it as a reward at the end of the day for say a half hour, you pretty much know what they're doing the whole time because you're able to monitor that, versus if they get access to it all day, all the time, it makes it much more difficult to monitor exactly what's going on. So trying to use all the parental controls that you can for one, limiting access to it as just being sort of like a free thing that they can have all the time, because then, and also that goes to leisure life skills. Sometimes we'll see kids get really, really focused in on an iPad and it's hard to get them to engage in other activities. So trying to limit iPad or computer to more like reward time, and making sure that it's small enough time that they're on it during the day that you can really heavily monitor their activities.
And then how about, having these conversations with a child who's maybe resistant to the changes, maybe finds them to be inappropriate, whether it's the conversation is inappropriate or the changes themselves? Are there perhaps maybe books or resources you could recommend to help parents with that?
Yeah, there are lots of books. I'm happy to maybe put together a resource list that was not included in these slides that maybe we can attach or get sent around to people somehow, or attach to the post wherever it is, so that you can look at some of the resources. But there are lots of different resources about books, there's healthy body books that you can just kind of read, that kids can kind of read and look through. There are lots of ones, especially for girls. I also think about, if you're really starting early, you can kind of go baby step through this. You can baby step through this process a little bit more than if all of a sudden a girl has her period and all of a sudden the hygiene habits need to change immediately. So I think if you can baby step your way into it and start by looking at the resources that you do have, start talking about it, and then what are some little baby steps that we can make to the routine to help them be successful.